Movik Russell, Benita Das, Nityavashini, hello. Mai Mohammad Iqbal, Rauful Momin, say hello. Please follow the page, the Facebook page, subscribe to the YouTube channel. It's all useful information there available for all of you. The Instagram page is there, Chennai Colorectal Clinic, and my page as well, Venki247. So there's lots and lots of information which you will find useful. Hi Shambal, hi Aisha, hi Rifle. So interesting topic, anal itching we have today. So we will talk about it. Very common problem. So we'll start that in a minute or so. Hi Bhargavi, hi Science Edens. So as I said, keep using the mask. Very important. That's the only thing which is going to sort of bring this whole problem down of the COVID-19. And maintain your social distancing. So it's good to be back. So if there are any questions, please put it in the chat box, and we'll answer most of them today through the live session, or I will answer to you. I'll message you back a bit later after I finish the session. So anal itching, very common problem. There could be one of the most common things which patients come to our clinic for, and several issues are there with anal itching. So it's a common condition. The itch usually is situated around the anus. It's again can be very intense and annoying, making the patient to scratch, and it can be embarrassing and uncomfortable. You could be amongst other people. You could be in a meeting at work, and so that's a serious problem. So there are many causes for anal itching, also known as pruritus ani. Pruritus ani. Okay. Some skin conditions or problems can cause anal itching. Hemorrhoids can cause. And then washing too much, just wiping the area often, trying to be maintaining genital hygiene. Sometimes we use paper, we use soap, sometimes you wash too much or wash too less, so that can all cause itching. But usually it goes away as long as you wash and keep the area clean. But if it's persistent, we need to see a doctor, and with usually proper treatment and self-care, usually settles down. But it can be annoying, and lots of people suffer from it, and it's a major problem when people get affected. Okay, so what else can you see? So you can have this intense itching around the anus. There can be some redness or burning, soreness. Sometimes it can be temporary. Sometimes it can be persistent depending on the cause. It can be intermittent. So what we need to do is to keep a diary of these symptoms, because if it becomes persistent, so that you know whom to go and see, and when you go see the doctor, you can give a history, which is very useful. So when you need to, as I said, most of the time, usually just washing the area clean with water and doing the simple things will take care of it. But if it's persistent, if there is bleeding, there is soreness, if the area looks infected, and then you need to see a doctor. It's, as I said, it's not one medicine to treat. We need to find there are several causes of anal itching, which is not easily identifiable. So we need to look at all the causes. So one of the most common ones are irritation around the anus. Why? How does it get irritated? Irritated because it could be that there's anal, there's fecal leakage. After going to the toilet, passing your motions, you don't wash that area properly, then some fecal matter can irritate. Or if you have chronic diarrhea, or you had a bout of diarrhea, and that area can get irritate the skin because you're using the loo often. And also skincare products. Some people use different ointments, creams, and genital hygiene products, which can also irritate. So you need to be careful. Again, avoiding harsh soaps, moist wipes. And washing aggressively, can also cause these. These irritants can cause anal itching. Again, infections can cause. So you need to be very careful what infections can cause. Usually, these include sexually transmitted infections, so need to be careful about those. Pinworm infections are very, very common, and yeast infections. These are all common infections which can cause anal itching. There is also skin conditions which can cause anal itching, particularly psoriasis. And then there's something called contact dermatitis, something which has come in contact to that area. It could be a new underwear, it could be a material in the underwear which is, or dye in the underwear, or clothing which comes into contact. It could be even soap, with harsh soaps, or body products which people buy and sold commercially can also cause these problems. So you need to be aware of these things. Okay, so just keep messaging if you can hear me clearly, and say hello so that I know all of you are here. I'm not sure. Okay. Hello. Can you hear me clearly? Yeah. If you could respond, then it becomes very easy for me to communicate. Yeah. Excellent. So we were talking about. Okay, so anal itching is what we're talking about, and we've talked about symptoms and the causes. So there are medical conditions which can cause anal itching, right? So these could be diabetes, thyroid disease. Okay, so these are medical conditions which can cause anal itching due to the disease process. So you need to make sure your sugars are well controlled. And thyroid is very common, both in men and women. So we need to make sure that that your thyroid function tests are done and they're within the normal range. If not, then you need to go and see a physician to get that sorted out. Now, coming more specifically in the colorectal space, for anal problems, hemorrhoids are one of the most common causes of anal itching. Okay, hemorrhoids or piles. So hemorrhoids or piles are common causes of anal itching. So why? Okay, so as I told you in several of our live sessions, hemorrhoids are anal cushions which we have around the anus, which they give an airtight seal so that the gas or the liquid when you have diarrhea doesn't leak out easily. Okay, they are like cushions. Now, what do they do is when you're constipated or you strain too much, these cushions start to prolapse out, right? And these are called hemorrhoids. So they are graded 1, 2, 3, 4. So if the cushions need to be inside your anus so that they provide. But if because of straining and constipation, if you put it out or it starts to come out, then it can cause itching, because what happens is it doesn't give you an airtight seal around it, because the cushions, the tissues are trying to come out. Now, so that because of that, you don't get an airtight seal in the anus. So any lubricants which we have, mucus as we call them, in the rectum to lubricate the motion when they come out, all that can leak out. Fecal material can leak out and cause itching. So we need to be mindful of that, because hemorrhoids are common. Another problem could be anal tumors or cancers and things. So if it's persistent, then we need to get it checked. Okay, so how do you get it checked if it's persistent? Is to go see your doctor. Ideally, you should see a specialist, because it needs to a full history, detailed examination, and then so that then they'll have to check for pinworms, and a digital rectal examination is very important. Make sure your diabetes, thyroid, all that is checked, and then I think it becomes absolutely important that these are looked into carefully. So sometimes you can have a skin condition, as I told you, and then you will need to be referred to a dermatologist to have further treatments. Sometimes, rarely, we may never identify the cause of itching. It's there, and sometimes we need to give medicines just to take that edge off, that sensation. So that's one aspect too. So the treatment would be to firstly, simple things to good genital anal hygiene. That's very important. Also, a non-prescription, a simple anti-itch cream, or treating the worm infections, which is easy enough, and also managing the hemorrhoids. Like, if it's a simple grade 1, grade 2 hemorrhoids, you can get them banded, and that will sort it out. The next thing we should do is, if these symptoms are worse, the itching at night, then we may have to we can give them some oral antihistamines, which are like anti-itching medications, until you get an anti-itch cream. Okay, so with proper care, most of these symptoms should settle down. There's also lifestyle and home remedies you can do. One is like, cleanse the area gently, avoid scrubbing, then dry the whole area, and if there is fecal incontinence, diarrhea, we need to just carefully wash and apply a moisturizer on that area. The main aggravator is scratching, and I think we need to learn to control that. Make sure your nails are trimmed. Sometimes you may have to wear some cotton gloves so that you don't go, and even if you scratch it doesn't damage that area. Wear cotton underwear, which is not very tight. Avoid irritants like sometimes you have bubble baths and applying sprays around the genital area, and harsh soaps. So those things can aggravate it. Changing your diet will help, like cutting back on coffee, chocolate, alcohol, citrus foods, spicy foods, which may aggravate the stools and diarrhea. Sometimes overuse of laxatives, so that you want to clear everything out, you will take lots of laxatives, and that will make it worse. Okay. Sorry about that. Okay, so those are simple things to do. Changing your diet, as I said, and then watch your bowel movements. Okay, so those are simple things to do. Very common problems. A common problem, anal itching. So I want you to have that in mind. It can be a big nuisance. So I've given you simple things to do. So do that. So now let's see what questions. Okay, so can piles be fully cured? Yeah, from Pulkesh Roy. Piles is a common problem. The most common issue with piles is constipation. So if you drink lots of water and have a better diet, cut down on your red meat, more vegetables, more fiber, good exercise, all these things will help. And you can stop it from making worse. And if hemorrhoids are already developed, you can do simple things like banding, which is an outpatient procedure, to sort that out. So there's Ranjan, who's had a fistula surgeon and a ceton placed, who's got some issues. So Ranjan, you need to come back and see us, because a ceton is there to, for a complex fistula, we do 2 stages. A ceton is there to just settle all the infection down. So I would want you to come back and see me in the outpatient, so that we can plan a 2nd stage procedure. Okay, there's a question from Shivakumar. Ideal day gap between changing colo bags for permanent colostomy done by. So an APR surgery is when, particularly for rectal cancer, the anus is removed and you have a stroma or a bag coming out through the abdominal wall, through which the fecal matter is expelled. It used to be a big taboo few, maybe years ago. Now it's, you have so many good products, and people generally have a better quality of life. They can get back to the they can get back to the playing or to the office and do their normal work. So to answer your question, Shivakumar, the bags can be changed. There are different bags. There are bags which can be disposed of every day. There are bags which, there is a base which is stuck for I think 2 weeks, and then the top component can be emptied and then washed and put back. So there are several options available. If you contact the clinic, if you can contact our clinic, we have a stoma therapist visiting to help patients like you to answer some questions. So depends on what the company you're using or the bag product. So just call the clinic, Chennai Colorectal Clinic, or the stoma clinic at the Apollo Hospital, and we'll be able to help you with that. More than happy to do that for you. Okay, so let's see what else questions are there. Any other questions? Keep adding in. So I thought anal itching is a huge problem. I find it as a challenge to treat in the clinic. So that's one thing to deal with. So the next thing when people often are asking now is it safe to go back into hospitals after surgery? Now, as most of you know, is that at least in India, the incidence of the viral infection numbers are going up, but in most of the big cities like Delhi, Mumbai, Chennai, the infection rates are starting to fall, which is a good sign. Yes, there were 7 people who were ill, but I think the numbers are stabilizing. But in the districts, the numbers are going up, which it will, because that's how a viral illness works. So, but in a few weeks, in a month, the peripheral districts should also settle down. So at least Chennai, Mumbai, and Delhi are starting to stabilize a bit more, which is good news. But what is important now is that now we know roughly or more clearly how to manage the virus. So what we've done is there are hospitals which are marked for COVID, and so people are getting treated there. As you know, the critical cases are very, very less in the overall infection rates. So they are managed in the hospitals and the critical care area. And hospitals are clearly demarcated non-COVID areas, or several hospitals are no COVID patients are admitted. So we just need to be careful. And so what we do is if we are undertaking all emergency surgery, we are undertaking all cancer surgery, and all surgery which is urgent in the sense there's lots of pain, it's an abscess which needs to be drained, infections and things which are, elective like a hernia surgery, but not causing any pain or, symptoms, then we can wait. But if it's causing symptoms, they need to be sorted out quickly. Okay, so what precautions we're taking? So patients are obviously taking full history with their family, whoever comes along with them are taken. They're all COVID tested after being admitted into hospital. So for surgery. So if you're planning surgery, patients are admitted, tested for COVID. They don't go out. The next day they have surgery, and then they get discharged. When they recover. So that way. We cut down on the risk of people having a test and then waiting for some time and then maybe catching the bug, and then so that way it's much safer. So we are close to all my normal operations now, except the elective ones are very elective, non-urgent, painful ones are all not being done. But otherwise, cancer work is in full flow. And we've very safely done, so I had nothing to worry. So we're starting to learn to live with the virus, and I'm hoping that and I'm looking at the rates in Chennai, the numbers are stabilizing. So I'm hoping this is going to settle down soon, and hopefully we'll get a vaccine by the end of the year or early next year. So that will help us. So I think, and also what I need to remind all of you is that non-COVID medical problems like heart disease, diabetes, high blood pressure, all that needs to be treated, and you need to be seen by your physicians, because all that can cause trouble. Every year we have people, as I said, there are 70,000 new colorectal cancers diagnosed in the Indian subcontinent. That is around the country, Bangladesh, Nepal, Pakistan, Sri Lanka. So, there is a big proportion of people who get that, and there are lots of people who, get TB, strokes, and it's important that we pass on this message to friends and family to reassure them, to say that as long as we know the healthcare facility is safe and taking the precautions, it's absolutely okay to go and have your treatments. Wear your mask, keep your social distance, and clean your hands regularly, and that should be fine, right? So that's what we're saying. So let's see, there's a few more questions coming in. So what are the risk factors associated with piles? Risk factor I said is one, you could develop hemorrhoids. The worry, as I say, I keep reminding all of you, is that the symptoms for hemorrhoids and colorectal cancer is the same: rectal bleeding, change in bowel, incomplete evacuation. So if it is few days symptoms, just change your lifestyle, drink lots of water, and stop eating out and things. You should usually, but if it's persistent for 6 weeks, you should get it checked, because it's all possible. You're seeing colorectal cancer in young people, so don't ignore it. If it's more than 6 weeks, you need to get checked. So risk factors, mostly it's a constipation, change, lifestyle, not drinking enough water, all these things can cause it. Difference between internal and external hemorrhoids, I said there are 4 stages. Stage 1 is when the hemorrhoids just swell up, they are inside the anus. Stage 2, when they start to come out but go back in on its own. Stage 3, when it comes through the anus, when you strain and you have to use your finger to push it back in. And stage 4, when it's outside, right? So stage 1 and 2, most of the time you can treat it simply with lifestyle change and also maybe taking laxative if it's constipated, and then also see the cause. There is a cause and an effect. The cause is the constipation, straining. The effect is the lumps which are coming out. So if you treat the cause, it gets better. Sometimes it will settle down, but once it's affected and you see a lump, then it's a mechanical problem which is causing this lump to come out, because it's a bulge of blood vessels, as told you. Now they need to be banded or shrunk so that these lumps will shrink and go away. So banding is a very good outpatient treatment for hemorrhoids grade 1 and 2, and recent research shows that it can be as effective as a hemorrhoidectomy to cutting it out. So you can do it, repeat it 2 or 3 times, but it's simple, it's safe, it's painless, and banding is an excellent treatment modality, and I used it often in my clinic for patients, and gives very good results if done once or twice with your children, and because it's simple and safe too. And somebody, Ranjan Davids, asked the question about how do you manage anal varices? The answer is the same. Anal varices are like hemorrhoids, and the treatment is the same. Hi Sanjay Datta, good morning. Hi Pramendra Jain, how Murugan Kansami. Okay, so that's those questions. Any other questions? Keep popping it in. I'm very concerned about the 70,000 patients which we have in a year of colorectal cancer. And I think we need to do more awareness, talk to our families, and because the good thing about colorectal cancer is that it can be cured if picked up early. Majority of our patients come late, but if we can pick them early, people do really well. So symptoms to remember are rectal bleeding, change in bowel habit, which could be constipation and diarrhea. Then weight loss, anemia, feeling a lump. These are symptoms which is present more than 6 weeks. Then you should see a doctor, get checked, get screened, and it's very important. So there's a question on Instagram asking pain after passing motion, but there's no bleeding. Yes, I'm sure all of you who come regularly on the show are experts in this, and okay, don't start treating patients. I'm just saying, if you have pain when you go to the toilet after passing motion, if you have pain, particularly a tearing type of pain, which which is like burning, and it's like as if somebody's broken glass and put it around the anus, some drops of blood or not, most common cause is a anal fissure, okay, which is like a cut in the anal edge. That's because of you pass hard motion, it makes a cut, and every time you pass motion, it splits that area and causes severe pain. So it's an anal fissure. It's one of the commonest things we treat. The important thing is to soften your stool, and also there are a few ointments which you can apply to relax the muscle and heal the fissure. So anal fissure, very common, and I told you the difference between anal fissure and hemorrhoids are, in hemorrhoids, it's painless rectal bleeding. You can see anal lumps around the anus that you can, as I told you, grade 1, grade 2, grade 3, grade 4, as you strain and make it worse. But it's painless rectal bleeding usually. With hemorrhoids, with fissure, you have pain when you go to the toilet, particularly tearing pain, and it's a very bad pain. It lasts for 3 to 4 hours, and it really affects people. So medical treatments are available. Surgery is the gold standard for a fissure. Extremely good operations available for that. So you can have pain with piles or hemorrhoids too. That's when you strained a lot, and one of the blood vessels that is around these cushions go pop or burst, and they form a hard lump which can be painful. Sometimes you need a small operation to get it out, but otherwise usually it settles in a few weeks time. Okay, so that's between fissure and hemorrhoids. I hope that was okay. Let's see any other questions coming in. Okay. So there's a question saying I've been taking clamifenamine with 3 liters of water. They said I have so the clamifene, you need some ointment as well. So we need to examine you, first to confirm. The treatment for fissure is a specific ointments. We need to first examine you, confirm that it's a fissure, and then the ointment can be given which will specifically clear that. Then the laxative which will help. Change in your lifestyle, which is like drinking more water and your diet. Avoiding fast food, spicy items. All these things should be stopped, at least temporarily, and that will help. Okay. So for those who joined in late, we spoke about anal itching earlier, and if there is anybody who wants to have any questions about anal itching, please comment in the chat box or ask in the chat box, and then we'll get that answered. So we spoke about surgery and medical treatment for non-COVID conditions, and I think it's important that we get that sorted out. People should seek treatment. It's important. It is getting safer. We know how to manage it. As long as you wear a good quality mask and maintain social distancing, you'll be fine. So please tell your families, friends that it's fine and you'll be okay. So there's a question: can I have chicken non-spicy? You can eat what you want as long as your stool's soft, and that's good, right? So if there's any questions you have about in this space, hemorrhoids, anal pain, rectal bleeding, please ask in the chat box, because what we're trying to do is to do this every Sunday, so that people come and have a chat, and ask any questions regarding medical issues which they may have, particularly colorectal, which is what our subspecialty is. And colorectal cancer, hemorrhoids, and all those things. There's something called diverticular disease which we've not touched on. That's an interesting topic. So diverticular disease is a condition affecting the colon. Okay, most commonly the sigmoid colon, which is, I don't know if you remember, I told you colon is like a question mark. The sigmoid colon is on the left side, above the rectum. It's probably about 20, probably 50 to 70 centimeters long. It's a floppy bit of bowel. So what happens is, as the colon develops small pockets along the bowel wall. Okay, that's what you need to remember. Small pockets, and these pockets can can get infected, so can cause pain, can bleed. you can have rectal bleeding. Also cause a lot of bloating, and so most common in in older people. It comes with age. That's because the blood vessels which go, supply the bowel or colon wall through, they sort of go into the bowel, colon wall, and that area becomes weak. So that's it's a bit technical. You don't need to worry about it. But diverticular disease is becoming more common because our population is also getting older. Patients develop little pockets along the bowel wall. So they can cause symptoms of bloating, constipation or diarrhea, rectal bleeding, change in bowel habit, as I said, and abdominal pain too. So diverticular disease, and if it's inflamed, we call it diverticulitis. It's becoming more common, but in Asia we can get diverticle along the all along the colon, more so on the right side of the colon, but left side colon, it's a disease of the Western world because of the diet they eat. But our diet patterns are also changing, so diverticular disease will become prevalent in our population too. So what do we do about it? So the good thing about it's not cancer or anything, but it can mimic cancer. And you look at scans, if you have, so it can affect that bit of colon and become the whole colon can be like a pipe, become like a pipe. So difficult to because it's become thickened of the repeated inflammation of these pockets, and so there can be some confusion. It can look like cancer on scans and things, but it's nothing to do with the cancer itself. It's a benign condition, but it can mimic or look like that. Okay, so Rajalakshmi is asking in Tamil. Yeah, next week we're going to do Tamil. Yeah, that's my mother tongue technically, although I'm originally Telugu. I was born and bred in Chennai, and Tamil is what I speak. Everybody at home, and of course I'm proud of my mother tongue. But we live in Chennai, and we love our Tamil here. And of course, next week we'll do both Tamil and English, because a lot of people join from other parts of India and other parts of the world. So that's why Rajalakshmi, that we don't just use Tamil. But I would love to do one full Tamil. So maybe we'll get some translation going on. So that can be sorted out. I'll figure that out next time. I know it's possible. Okay, so coming back to diverticular disease. So how do you manage diverticular diseases? Okay, so you have these symptoms, you go see the doctor. Most commonly, you can do a CT scan or a colonoscopy, which will identify this problem, confirm it. Sometimes, at 25% time, it can mimic cancer, so you may have to do biopsies and stuff if it's a very tight narrowing because of the diverticular disease. Sometimes so confusing, we're not sure, and it's causing a lot of trouble. We may have to remove that bed of bowel. So that's later, but I'll just tell you, the investigation would be CT scan, colonoscopy. How do you manage that? Confirm. How do you manage it? Lots of water, good diet, high fiber diet, avoiding meat, low residue diet, which that easily which can help you with that. Now, if patients are getting recurrent bouts of inflammation, diverticulitis, then you may have to remove that bit of the bowels. Okay, so you can do that surgery through open surgery, minimally invasive, which is laparoscopic. Robotic surgery is what we do because we find with robotic surgery more and more that it's less complication, less wound infection rates, less bleeding, and less length of stay and less readmission rates because of the quality of surgery you can achieve. It also depends on the team which delivers the service, so you need to find a good surgeon. So that's that. Okay, so so there's somebody who's had surgery with us a few years ago and was generally doing well. Now he's got some blood. So we should do another screen, Rajat. We need to put a camera and just have a look so that make sure no other problem is there. So just get in touch with us, email us, or call our 24-hour hotline which is with the sister there, and she'll guide you and we'll sort that out for you. So any other questions which we need to, pressing questions, please ask. So there's one question here regarding, again, anal itching, hygiene. Hygiene is very important with anal itching. As I mentioned earlier, it's important to wash the area clean, not use very hard, harsh soaps, because there are so many fancy ones available. Doesn't mean that they are very good for your skin. And the genital area and the perianal area are very sensitive skin. You need to be careful and use cotton underwear as much as possible, and also not too tight underwear, particularly the men, not too tight on the underwear. So that is one. And also, so you just need to be careful of the clothing, hygiene related products which you use. Make sure that the things like diabetes and thyroid are all checked. So this question regarding again a fissure, sucral, so what you can or you can apply something from lignocaine gel to reduce the pain, but important is to get a very specific ointment. So that needs to be confirmed by a doctor, and so that you can prescribe so that this problem is solved. Anal fissures are not a nice thing to have. It can be very painful and it can make you very uncomfortable. So I would suggest that get it treated, get the appropriate ointment, and you should settle down. But for pain you can use lignocaine gel. That's what I would recommend. It's simple, safe. Okay, so another 10-15 minutes to go. So any other questions, please type in. Good to see you, Kongon. Good to see you, Krishna. Good to see you, Mr. Bardhan. Okay, any other questions? Please type in. Okay, so we've again covered a wide range of topics. And again, as I said, it is getting safe to get back into the hospitals. Just need to take your precautions, and I think that'll be good. Make sure your diabetes, heart disease, all that is looked at. Please don't ignore them, because heart attacks happen, people getting TB happens, people getting uncontrolled sugar. All these things are happening all the time. So they're not going to go away because COVID is here. We know how to manage COVID reasonably well now, because there is a pattern to it. If you're having fever, dry cough, tiredness, diarrhea, loss of smell, all these are symptoms. If you have it, you need to go get tested and you need to isolate yourself. If you're having breathing difficulties, then you get in hospital, and usually it's self-limiting. In a week or two you'll be fine, and you need to stay away from your family members so that you don't cross infect them. So we know how to manage them now, and as long as there is a strategy and you have a plan when this infection happens, then you should be fine. Okay, so I'm just looking at any other pressing questions which are happening. Let me know so that we can. Okay, what is the cause for passing stool within a few hours of eating? Okay, but it's a good question. But so lots of patients complain that as soon as I go to have my food, I feel as if I have to go and evacuate. Now, common symptom. Okay, good point. Thanks for raising that. Now, so there is a brain-gut axis, which is like a reflux people get. When you like having coffee, it sort of stimulates thing, and also having. So one of the reasons why this happens is that there is a reflex system which is set up. We all have it. The one which aggravates it is that if you have hemorrhoids and things, as I told you, the anus is what controls and keeps the motion in, and you have hemorrhoidal cushions inside to give you an airtight seal. Now, when these are swollen up and they start to enlarge and they become grade 1, grade 2, they keep irritating that area. So that reflex gets accentuated. That's my understanding of it. So, so you can have an incomplete evacuation. You've been to the toilet, but you still feel something is there. And then when that reflex gets activated, it gets accentuated. So the important thing is to, make sure your bowel habits are regular and make sure you don't have hemorrhoids. And we need to have a doctor check, make sure that those things are done. So, is colorectal cancer a genetic disease? Yes, it is. So, if there is anyone in the family, for example, if the father has it, let's say the father has been diagnosed with colorectal cancer at the age of 60, as I told you several times, the good thing about colorectal cancer is it goes from benign polyp to a malignant polyp. It normally takes 10 years for that change. So if it's 60, usually it would have been evolving for about 10 years. That's what the usual time frame is. So that's why they start screening, and it's common after plus 50. So the screening programs around the world, the Western world, is 50 plus. So what else you need to know about colorectal cancer is that so if a father has it, the father's brother, sisters need to get screened because they can also develop it. As soon as they've been diagnosed, they should be screened with colonoscopy. The children also are at risk, so they need to be screened. Very important point to remember and make the patient's family aware. So as I told you, 10 years is the time frame. So if the father or the mother had it at 60, then the children should get started screening at 50. But if the children have symptoms at whatever age, they should get a screening colonoscopy. So it's very important. Okay. So good question. So Sonal has asked, what precautions do we take to keep safe during this pandemic since we're interacting with? So what we do is patients, when they come to our private clinic or to the hospital or the Apollo in Greens Road, what we do is all of them get screened. If they have fever, they send straight to the fever clinic. Whatever condition they may have, it's cancer, non-cancer, cough, TB, diabetes, whatever. They go to this fever clinic at the hospital. If they come to the clinic and they have any of these symptoms, they're referred to the fever clinic in the hospital. So anyone with fever or symptoms are referred to the fever clinic, where they get screened, they get the COVID test negative, and then they can go have their other treatments. So what we do is we wear a mask, particularly if we are in high risk areas. We wear an N95 mask and also a face shield. And most of us in this period have been using theater sort of what we call theater blues, or it could be now in several fancy colors. There are several makers of this, which is very useful, very good, particularly Uniform Craft, which is a good friend of ours, Rajesh, makes them and his wife. So high quality, Rajesh Devraj and his wife. So they make very good quality, sort of hospital. We call it theater blues. So it can be whichever color, and you can have different cuts to it, but it's safe because it's easy to wash and on a daily wear and take off, because you wear we're trying to avoid formal clothes like jackets, ties, and all those things. You can wear. I don't think it's a particular risk, because surface to surface contact risk is very less as long as your hands are clean, because in putting it in your nose or particularly is where most of the risk, or people coughing in your face or speaking when they're highly infected is when you transmit. So those are the precautions we take. So we maintain the social distance, and doctors also take turns. As I said, we had cancelled all elective work, only cancer work and emergency work, and now we're slowly getting back with all these precautions. So and also patients who come for surgery are all COVID tested and their families. So those are routine things we do. Okay. So there's a question: colonoscopy last December. said only fissure and ano. Do I need to do once again since I get? No, I don't think, once you have a normal colonoscopy, usually I say a colonoscopy is good for about 5 years, roughly speaking, unless you have developed new symptoms and you need to be screened again. Otherwise, it's good. And if the fissure is the issue, then we need to address the fissure. So lifestyle changes, water, and the specific ointments to apply. So those are the things which are important there. Okay, so any other questions to answer? We have another 4-5 minutes to go. Please key in your answers, your questions. I'm happy for you guys to answer as well if you. Okay. So one request is to like the Facebook page if you haven't already, and subscribe to the YouTube channel, Dr. Venkatesh Munikrishnan, and the Instagram as well, so that we can get this information flowing, because it will be useful. These questions are practical questions which people have on a daily basis, so that we just try to answer them as much within my knowledge domain. There are things which I might not know, and I'll refer them on to someone else or answer them when I find out for you. So this platform is primarily create a interactive platform, Sundays, which is good. Once we get really busy, then it may be a challenge, but we'll try to do this, because at least the pressing or questions which you forgot to ask someone to ask, particularly in this place. Hi, sir. Okay, so what are the questions? Any other questions? So there's a question: are we visiting Kolkata? We used to do every 2 months a clinic in Dhaka, Chittagong, Calcutta. So we used to do it, but again, because of all this COVID, all travel is stopped, and that's why these social media platforms are the future, and online, because it's going to take all this information across, and you can now do online consultations, which has gone, really revolutionized the way patients seek medical advice. Again, please remember, these are very useful, authentic and a good way of doing it, but you may have some conditions which may need a clinical examination. So bear that in mind. Sometimes patients expect everything to be done online. Most of them can be done online. Advice can be, medications can be given, but sometimes we need to examine you. Particularly a lot of these anal problems there are slight variations in them, within the correct treatment needs to be given. So so we need to they may have to examine you, but remember that use the online platforms. We have several of those working very well, and you can contact us through any of those platforms. The Apollo 247 platform is awesome. It's awesome, and there's other platforms like Practo, and our clinic platforms also got some. We use one of these platforms, the 247 Apollo one is a very good one, so you can use that to contact us. I hope, so we're almost done here. I hope you guys stay safe, and next week we'll try to do a mixed language one. So I'm happy to answer in other languages, particularly the language I know, Tamil, Telugu, but it's easier in English, I suppose. But, we can do these things just to keep it very broad-based information, so that people from around the world who sign in, sign out can get the information they need. So if there's any other questions, please put it in the chat box, and I will answer those questions. So there's a question saying, yeah, you could Colonoscopy is not needed. If you've got symptoms, you can continue the medicines or come back to see us. We'll see what, because normally within 2 to 3 months these symptoms should settle. If it doesn't, then we may have to do something, right? Okay. So there's a question about GERD. Okay, so yeah, let's finish with that. Now, GERD is a very common problem. Gastroesophageal reflux disease. It's primarily due to the diet we eat, fitness, being overweight, lifestyle, and lots of people come to say, I feel very gassy, bloated. It's a very common symptom. And then the constipation. All these are interrelated. Do with your lifestyle. Lifestyle is very, very important. So I keep in these 3-4 months where all of us have sort of stayed home, not gone out and eaten much. Definitely personal experiences that eating at home, I'm very grateful for my wife because she makes good home cooked food, and I think it's had a great effect on me. Whatever reflux bloating symptoms I had, they are gone. I've lost weight because eating at home, obviously, she'll be smiling now, I'm sure, saying I told you so. And also, a regular fitness thing, exercising 40-45 minutes a day, at least 4 to 5 times a week is very, very important, because please remember, all these medicines, are all there to just temporarily provide relief so that you change your lifestyle. There is no medication which is a magic a tablet which is just going to cure these symptoms. It's just to do with your lifestyle. You need to drink lots of water, eat a healthy diet, eat on time. Yes, we all love to go out, hang out with our friends, go out with our families, but have that planned out. You can once in a while eating spicy, oily, fast food, rich food is okay, but if it's regular, then it's going to have a huge effect on your health, lifestyle, and on your and all these symptoms you have, and and your bowel movement. Exercise is so very important. The more you exercise, the fitter you get. You feel confident. Particularly in a time where all of us are staying home, a bit depressed and low. Exercise is the ultimate mood elevator. So please exercise. It's good for you. It's good for your health. It will cause your symptoms to go away, and you will feel a lot better. So either be bloating symptoms or colorectal symptoms, constipation, everything gets better with exercise and on a right diet. So I'd suggest watch your diet and do some fitness regime, very important, whichever you want to choose. It could be yoga, it could be walking, it could be running, cycling, some form of fitness is excellent for your general well-being. So somebody said high blood pressure and cholesterol, what should you do? I think you should go see your family physician, get it all checked, mapped out, get onto if you're overweight, on a weight management plan, watch your diet, eat on time, sleep. Sleep is so important. If you sleep well, half your general well-being will improve. So you need to be managed by your physician so that your general health improves. Okay, so we're almost done. So what type of exercise for hemorrhoid? I don't think it matters. I think as long as you don't strain, so a lot of people who do weights develop hemorrhoids because you strain a lot, you put a lot of pressure, and that's one of the reasons. Similar to constantly putting pressure on your pelvic floor muscles. So not a great idea of hemorrhoids to lift heavy weights. So just regular cardio workout should be good. Okay, so IBS, yes, IBS is irritable bowel syndrome. It's different inflammatory bowel disease, which is Crohn's and colitis. IBS is irritable bowel syndrome. Basically means it's a sensitive gut. It could be due to lots of things. It could be due to stress. It could be due to we don't know exact cause. Most of the time, it's because of stress. The way to diagnose is do all the tests and no, nothing's found, but then we say irritable bowel. Yeah. Most of the time, stress management, and avoiding foods which will aggravate it, cause the bloating, cause the constipated diarrhea. Just avoid the diet. Just being very careful about the diet should usually solve the problem. Okay, so I think that's almost time. That's great. Thanks, guys. So for joining in, and I will see you next week. So I'm happy we discussed about anal itching. It's a can be an annoying problem. So but at least we got some points out so that you know what to do. So we'll meet next week. We'll discuss similar issues, and if any other issues, just message me on the chat box, and I'll try to reply to you. And I'll see you next week. Bye bye.